Patients over 80 are considered high-risk candidates for coronary dental transplant, not only because of normal body wear, but also due to comorbidities and risks of complications after surgery. No difficult and fast directive is available to assess the risks and benefits for octogenarians. Patients and doctors often choose not to carry out surgery, and this decision has its own risks and disadvantages. A new retrospective study by Mayo Clinic reveals that, although there is a higher surgical risk for patients over 80 years old, coronary decking transplant can be associated with favorable results and increased long-term survival. Additional research is necessary to identify groups of patients who can most benefit from surgical revascularization, according to an article in the Mayo Clinic. The researchers examined the history for 1,283 patients over the age of 80 and underwent an isolated coronary pontage transplant at the Mayo Clinic in Rochester between January 1, 1993 and October 31, 2019. The survival period median was 7.6 years, against 6 years for age and octogenarians corresponding to age and sex in the general population of the United States. Our results show that coronary pontage surgery can be beneficial for patients over 80, said Kukbin Choi, MD, Mayo Clinical Scholarship holder in cardiovascular surgery, and the first author of the study. The key is to carefully identify patients who can benefit from the procedure. This is what future research can help. Identify patient subgroups that can benefit the most. The patient survival rate was 90.2% to 1 year, 67.9% at 5 years, 31.1% at 10 years and 8.2% at 15 years, according to the study. The surgical mortality rate was 4%, but it decreased significantly during the 26-year study period. Mortality in the last 3 years of the study period was 1.6%. The risk factors associated with a reduction in survival time included advanced age, diabetes mellitus, history and chronic pulmonary diseases. Just over 56% of surgeries were procedures to choose from, 40% were carried out in urgent situations, and 3.8% were emergencies. Longer median survival in octogenarians undergoing surgery and relatively low complications observed in our study imply that with the candidacy of tailor-made surgery and taking into account specific high-risk factors, the transplant coronary pontage can be an important treatment strategy for patients with multivalve coronary disease outfit, explains Dr. Choi.